Hello everyone, happy weekend. I hope we are enjoying our weekends. Now I want to talk about polycystic ovarian syndrome, PCOS. It's a gynecological condition that affects women of reproductive age. Now, the major symptoms that it produces is infertility. So you see these women that are in their reproductive ages, they are not able to give birth, they are not able to conceive after staying for 12 months with their partners, having unprotected sexual penile-vaginal intercourse, yet could not conceive. So what are the symptoms that it presents with? You see these women, they are usually obese, overweight. You see them, they have hirsutism. Hirsutism, that is presence of hair in their chin, in their chest, like the way men have hairs. That is the way these women also have hairs in different parts of their body. You see them, they also experiences amenorrhea, that is absence of menses or irregular menstruation. Some of them are prone to having type 2 diabetes mellitus. Type 2 diabetes mellitus is a condition in which the blood sugar level is not regulated as a result of the fact that the body is insensitive to the insulin. Insulin is the hormone that regulates blood sugar, but the body is insensitive to this insulin, so leading to high blood glucose level. All these they contribute to producing infertility in these women. So how do you diagnose this? First of all, from the history, of course, I said they are obese, hirsutism, and by the time you do the blood sugar, you can see that the blood sugar is very elevated. Then you can do pelvic ultrasound scan. When you do pelvic ultrasound scan, the pelvic scan will show the two ovaries. The two ovaries, they are the organs that releases the eggs to be fertilized. So the two ovaries, they appear very enlarged and with multiple cysts in them, and that is where it derives the name polycystic ovarian syndrome. Now, if you also do hormonal profile to check the hormones that regulates the reproductive mechanism of women, you discover that the testosterone, which is supposed to be more in men, you discover that they will be actually elevated in these women, because remember I told you they have male characteristics, so the testosterone is usually very elevated. And there are other tests that we do, but these are the major ones that we give you a pointer that these people are having polycystic ovarian syndrome, in addition to the physical examination. So how do you treat these people? The first thing that is needed to be done is for them to shed their weight. Losing weight is very key to treating polycystic ovarian syndrome. For women that do not desire children, you can give them oral contraceptive pills. Oral contraceptive pills, they are used to control pregnancy. These drugs tend to regulate the hormones, thereby helping to treat or to manage polycystic ovarian syndrome. But for women that desire children, like I said, many people come to hospital because they are looking for children. For those that have infertility, what we do for them is that we give them a drug. We don't give those ones oral contraceptive pills because it doesn't make sense. Somebody is looking for child, giving a drug that is preventing pregnancy. No, we don't give them oral contraceptive pills. What we do for them, we give them a drug known as clomiphene citrate. They are drugs that are used to treat infertility. What this drug does is that it enables the ovaries to produce the eggs. It triggers ovulation. That is the process by which the ovaries releases the eggs to be fertilized by the sperm. So we give clomiphene. There are period of time at which you give it during the menstrual cycle. and you just need to follow the instruction that your physician will give you. There's a time you have to stop. There's a time you expect that the eggs would have been released from the ovaries, and there's a time you need to meet with your partner in order to get pregnant. Another thing you also give other hypoglycemic agents like metformin. Metformin is used to control diabetes. Remember I said that one of the symptoms is that they are also prone to having type 2 diabetes mellitus. So we also give along with metformin. There are other anti-androgen drugs that will decrease male hormones while increasing female hormones, like spironolactone, leuprolide, finasteride. All these drugs, you don't need to really know them, but your physicians will actually explain a lot of options for you. So that is it. If you have a friend or you are watching this video and you are the person that is having these symptoms that I said, obesity, hirsutism, hairs all over your body, you are having a male pattern of hair, then you check your blood sugar and they said it's elevated, and you are suffering from infertility. That is key. You are suffering from infertility and you hardly see your menses, or your menses are irregular. Please visit the hospital. You might be having polycystic ovarian syndrome, or that your friend might be having polycystic ovarian syndrome. Visit the hospital, seek for help, and get yourself treated. That doesn't mean that those symptoms cannot be other conditions. That is why you always have to visit your physician to examine you, carry out investigations, and make diagnoses on you. I hope you enjoyed this video, and I hope it's going to benefit you, either you or your friends, now or in future. Thank you very much.